Hi, I'm Jennifer Tescher, founder and CEO of the Financial Health Network. I often hear people say that our world is more connected than ever, but I'm not so sure. Over the last several months, I've been struck by just how fractured and fragmented our lives are. When tragedy strikes, when chaos erupts, rather than coming together, we isolate, we disconnect, we retreat and cling to the familiar. It's human nature to sort and separate things, to put them in silos, even people. It's how our brains make sense of a complex world. But just because it's human nature doesn't mean we have to accept it. In a highly interconnected world, siloed thinking is not merely limiting or ineffective, it's dangerous. Consider our response to the pandemic. Once the stay-at-home orders were handed down and consumer spending cratered and businesses began laying people off, our siloed thinking prevented us from asking essential questions. We had never thought to ask, what happens when people who are laid off of work lose their health insurance in the midst of a pandemic, no less? When essential businesses told their nurses and sanitation workers and grocery store clerks to keep coming to work, no one had thought to ask, how will we safely transport those workers who rely on public transit? And with schools and daycare centers closed, how will those essential workers find someone to watch their children? And when colleges and universities closed their campuses and sent students home, no one thought to ask, what about the students who don't have a home to return to? Instead, we were constantly caught flat-footed and 2 steps behind, in large part because we failed to see the connections. We also never considered that Black people might be far more likely to die from COVID-19, just like they are more likely to die at the hands of police. It took hundreds of thousands of people flooding the streets in cities around the world for us to finally ask, what are the systemic issues that we need to address to ensure that we value and protect Black lives? We do ourselves and those we serve a disservice when we shove people into categories: worker, renter, patient, students. We fail to notice that your renter is my patient and your patient is also a student. Our silos have hampered our response to the pandemic, and our silos have created centuries of racial discrimination, poverty, mass incarceration, and growing income inequality. If we leave these silos standing, they will keep us from seeing and understanding one another, and we will continue to endure the same difficulties. Just like the silos that store grain or the silos that house missiles, the silos of the mind are also human-made, and that means they can be torn down, which is what we must do if we're going to improve financial health and well-being for all. To get out of our silos and to see people for who they really are, we need to practice taking off our blinders. Take a moment to think of someone who has been important in your life, maybe one of your parents or grandparents. Let yourself actually picture them. Then imagine someone was to ask, who's your father? Or tell me about your grandmother. Would you describe them only by what they do for a living? Or only by where they live? Or only by their medical condition? Or only by where they went to school? When I do this exercise, I think about my grandpa, Larry Smilin. I lived a few doors down from my grandparents when I was growing up in Miami, and I smile every time I think about all of the fun things my grandpa and I used to do together. Back in the 1950s and 60s, before I came on the scene, Grandpa Larry was a traveling shoe salesman, a rep for Stetson Shoe Company. Every few weeks, Larry would get in his teal blue station wagon, turn on his CB radio, and head for shoe stores in cities and towns across his 7-state territory. He always had a sign in one of the rear car windows that said, "Samples only," so no one would break in to steal the big black cases in the back of the wagon, which were only filled with left shoes. That's all his customers saw, Salesman Larry. My grandpa never went to college. He served in World War II, and the GI Bill enabled him to purchase a house and access federal loans to pay for my mother's college tuition. But he also had serious health issues. An emergency appendectomy kept him stateside during the war. Then, after he got out of the Army and went to work for Stetson, he tore his meniscus, which back then meant major surgery and a year of recovery. That's when my grandma Sylvia went to work. My grandpa eventually got back on the road, but it turned out that he had inherited his father's heart problems. He had his first heart attack in his 40s, and then another, which led to open heart surgery. By that point, his days of traveling the Southeast selling shoes were over. My grandmother became the breadwinner, working as a department store sales clerk. Larry kept house and later spent a lot of time riding bikes and playing jacks with me. Financial shocks like the one my grandpa experienced when he couldn't work, and like the ones we are all facing now as a result of the pandemic, are contagious. They don't respect silos. While the need for work, shelter, healthcare, and education may appear distinct, they are deeply interconnected. And despite all of the data and technology and analytical tools at our disposal, our silos blind us to these interconnections. The result is a two-dimensional understanding of the people we serve. And that means we're not serving them well at all. Now, I too have fallen victim to a two-dimensional mindset. When I started the Financial Health Network 16 years ago, it was originally called the Center for Financial Services Innovation. And this conference was called the Underbanked Financial Services Forum. We talked about the banked and the underbanked and the unbanked. We essentially defined and categorized people by whether or not they had a bank account. And that narrow thinking led us to focus on a narrow question. How can we get people banked? Now, we've all been on the receiving end of a two-dimensional experience. I think about a hip injury I had a few years ago and the experience I had with an orthopedic surgeon. All he seemed to care about was my x-rays and whether they indicated the need for surgery. When they didn't, he shuffled me off to his assistant, who handed me a brochure for physical therapy. The surgeon just wasn't interested in my non-surgical needs. This kind of siloed thinking isn't limited to healthcare. When you work in human services, everyone tends to look like an employee. And when you're a landlord, everyone looks like a tenant. When all you have is a hammer, as the saying goes, everything looks like a nail. In our quest for efficiency and scale, we have focused too much on ourselves and not enough on the people we serve. If we want to tear down the silos and remove our blinders, we have to start by seeing people in 3 dimensions. That means seeing all of the facets of your customer's life: worker, renter, patient, student, in order to understand their true needs and find better ways to fulfill them. It's about listening, paying attention, hearing the context and nuance of people's lives. That nuance isn't merely nice, it's necessary. It's the raw material that we need to build businesses and programs and policies that solve real problems. At the Financial Health Network, the raw material from our financial diaries research, coupled with what we learned from the 2008 financial crisis, have helped us learn to see people in 3 dimensions, to take off our blinders and discover the essential question that we had not been asking. How can we improve financial health? Instead of bank accounts, we began thinking about what people were telling us they really wanted: to be resilient when times were tough, and to seize opportunities when times were good. considering the whole person as worker and renter and patient and student helped us to think beyond our self-imposed boundaries. The word for seeing the world through someone else's eyes is empathy. Too often, we let marketing messages substitute for empathy, but the customer sees right through it every time. Consider the Cleveland Clinic, whose story was documented in the book, The Silo Effect. The hospital was riding high at the turn of the 21st century. It was one of the biggest medical centers in America, with a $6 billion budget and a staff of over 40,000, and many of its specialties were top-ranked. Against this backdrop, in 2004, the hospital appointed a new CEO, Toby Cosgrove, one of the most famous heart surgeons in the world. Cosgrove was cut from the same cloth as most highly successful surgeons, ambitious and sure of himself. So he was taken aback when, during a lecture he was giving at Harvard Business School, one student stood up and told him that her father recently sought heart surgery at a different hospital because the Cleveland Clinic, while more highly ranked, lacked empathy. Now, empathy wasn't really part of Cosgrove's lexicon, and at first he dismissed her comments. But they stuck with him and gnawed at him, and ultimately he found himself thinking about the hospital from the perspective of his patients. Once he did that, he realized that the hospital was stuck in the wrong silos. It was organized into departments based on medical specialties, and surgery and medicine were two completely separate organizations. But how is a patient experiencing chest pain supposed to know whether she needs surgery or medicine? Over the course of 2 years, he upended decades of cultural and industry norms by reorganizing the hospital around a series of 27 multidisciplinary institutes that focused on ailments like cancer or body parts like the brain, with doctors and surgeons forced to work side by side. As medical professionals stepped out of their silos, amazing things started to happen. In the Orthopedic and Rheumatology Institute, the rheumatologists demonstrated to the orthopedic surgeons that monitoring calcium levels after surgery produced better results. In the Urological and Kidney Institute, the surgeons began working for the first time with the nephrologists to better understand the underlying causes of kidney stones. And together, they were able to develop cheaper, non-surgical treatments. By 2013, the Cleveland Clinic had risen from the bottom of the patient satisfaction rankings to the very top, while continuing to be highly ranked in nearly every specialty. Even more remarkably, the hospital was achieving these results at a lower cost. Let me say it again. Silos are human-made. They are products of human bias, a reflection of our culture, for good and for bad. But as the Cleveland Clinic demonstrates, culture can change, and silos can be dismantled. It's only when we tear down our silos that real innovation happens, even in areas not necessarily known for creativity. Take American Family Insurance, for example, a Fortune 500 insurance company headquartered in Wisconsin. In 2012, the company had purchased The General, which specialized in insuring drivers considered high risk and whose car insurance premiums were typically more expensive. American Family quickly found that while many of the General's customers struggled to pay their premiums on time, they were proactive in trying to structure payment plans. So the company decided to partner with designers from IDEO to see their paycheck-to-paycheck customers in 3D and to understand how they could help. Here's what they discovered. People needed an easy way to earn extra money. Most had full-time jobs, but the income wasn't always enough, or it wasn't consistent. So American Family launched a new subsidiary called Moonrise, a temporary staffing agency for shift work. The company sources and screens its policyholders, and matches them with opportunities to earn extra money. Since the launch of Moonrise 2 years ago, the company has expanded to 3 states and has helped customers generate $1 million in additional income. And while it might seem crazy for an insurance company to own a temp agency, both businesses are actually offering a similar value prop: peace of mind. So let me ask you, are you putting the people you serve in silos? Is it serving them? If not, then is it truly serving you? It may be scary to think about pushing yourself out of a silo in the midst of a crisis, but maybe it's the perfect time. Maybe we have no choice. In Chinese, the word crisis is actually 2 words put together: the word danger and the word opportunity. Right now, we have the opportunity to learn from the past and rebuild our systems to be more functional, more humane, more equitable, more integrated. I believe it is not just our opportunity, it's our responsibility. We must see one another with renewed empathy and clearer vision. We need to think anew about the meaning of economic justice and how to make it just for everyone. We can and we must break free of our silos and build an integrated financial health system for all. What if we were to break down the silos of our economy and reorganize around the financial health of the people we serve? For instance, what if you're a bank and some of your customers are out of work? You might create a temporary staffing business to match your out-of-work customers with the businesses in your portfolio that need workers. What if you're a doctor and it turns out that your patient's high blood pressure is actually caused by financial stress? Along with a prescription for blood pressure medication, you might also prescribe financial coaching sessions. And if you're a health insurance company, you could reimburse for the cost of those counseling sessions. What if you're a landlord whose tenants are sometimes late paying their rent because of tight cash flow or frequent emergencies? Well, you might offer an auto savings option to enable tenants to set aside a small portion of each month's rent into an emergency savings account. What if you're a college administrator and you realize that every semester some students come up short on tuition? Well, you might consider sending students a financial health scorecard alongside the end of semester report card. What if you're an employer with a large call center staff and post-pandemic, you expect them to continue working from home? Well, you might consider converting your investment in office space into investments in safe and affordable housing for your workforce. This is the kind of integrated thinking that we need to improve financial health. I mentioned earlier that our annual conference used to be called the Underbanked Financial Services Forum. We chose to rename it 7 years ago now because the companies and organizations we were working with told us that it was no longer helping them make the change in their institutions. Instead, it had actually put their work into a silo, and that was making it harder for them to get the broad buy-in and resources that they needed to build products and experiences to help improve financial health. We never could have predicted that the new name we chose, Emerge, would be so apt in the year 2020 as we consider what will emerge from the crises of these times. So much is uncertain these days, but one thing I am certain about is that we need more human engagement, more empathy across sectors and silos. We need to ask more questions and listen compassionately and open-mindedly to the answers. Engaging at an annual conference is great, and I miss being with all of you, but things are happening really fast, and being together only once a year and in any single place is just not enough. And so I'm launching a new podcast, Emerge Everywhere, to engage with leaders, innovators, and policymakers about how they're working to unleash innovation and creativity by seeing the people they serve in 3D. My first episode will air on July 15th. Visit emerge.finhealthnetwork.org. Click on podcast. I promise that I'll be doing more listening than talking. They say that hindsight is 20/20, and that rings especially true right now. Foresight, on the other hand, is not 20/20. It requires peering hard into the future and imagining what it could look like, what it should look like. Building the future takes more work, more energy, more passion, more innovation, and more care. To answer the question of how we can improve financial health for all, we first need to ask two others. What can we do to see people we serve in 3D? And what can we do to serve workers, renters, patients, and students in ways that recognize their common and complex humanity and creativity? Those are the questions. The answers are in the work that lies ahead, and it starts by tearing down the silos.